I enjoy most about my job is just the interaction with people and the community sense of feeling here. It's a really good, challenging environment to work in. There's plenty of good opportunities to develop your career professionally, and you're also dealing with some good people, good surgeons, good doctors that can pass on advice and help, and colleagues as well. It's encouraging to be here.
I enjoy seeing the relief on the patient's face when I walk into the room, because you can actually see the expression change. They will greet me and there's a relief because they say, oh, there's an interpreter, thank goodness you're here, because they know that without me they may not be able to understand everything the doctor or the clinician is saying to them. So I really enjoy doing that, and I feel that I'm enabling them, I'm empowering them, I'm giving them something back by being there.
I think patient mix is the biggest enjoyment I get in job satisfaction. I think we do a lot for the patients of the community that we see through here. The patients which come in are very interesting. They've got complex medical problems, they've got complex surgical problems, and that's my biggest job satisfaction. And the other big positive is the interaction with staff members between medical, nursing, allied health, working with the ancillary staff. I think it's a big positive. The staff here tend to work very well together.
The best thing for working here in CSSD is that we, behind the scenes, feel that we're making a difference for patient outcomes in the organisation.
Over that time I've had a long journey of over 40 years. I have associated with many people who've come through these hospital walls, and I currently associate with still a lot of those people I have known for over 35 years, along them being cleaners, surgeons, doctors, nurses, and I find that is a highlight of being part of Western Health. Western Health to me is a bit like a family. I come here and I've seen it grow over the years. I've seen it move from a small place to a now 3 campus site, and unfortunately I've been involved in a lot of the development, especially at Sunshine, and I've seen that grow into something that's works very well, and they are very high achievers out there. They work, highly as a team, and they've achieved a lot in the time that they have been functioning.
What I like most about working at Western Health is the fact that there's a lot of opportunity for growth, there's a lot of opportunity for innovation. We're doing lots of exciting things at Sunshine in particular around maternity and paediatrics. We've got a great service plan going forward and looking at how we're going to be into the future. We're currently doing some very innovative work in maternity with the biggest caseload in Victoria and the biggest midwifery-led model of care again in the state.
Now we have a lot of support for the graduate nurses, and also we have other support nurses such as the breast care nurses, stable therapy nurse, ICU liaison nurse, and the nurse to patient ratios of now 1:4. So we're able to care for our patients a lot more holistically and safely, and also I think they receive the best care possible here at Western Health.
I've had many highlights, but I guess the one that stands out is a research poster that I did for last year, just doing some simple quality assurance project within the ICU unit that got published as a research paper and presented at Research Week, and it actually won some prizes for a Best Allied Health paper and Best First Year Researcher. So that was certainly very rewarding.
What else brings me back? My colleagues, my boss. We're a great bunch here. We have fun. We need to have fun. It's a very stressful job at times. We're running around from ICU to the emergency department, patients on the ward, running to Sunshine, and then running back to Williamstown, for example.
When we do have the TTR being built at Sunshine, we would have the bigger opportunity of adding to our currently good clinical model where we've got a lot of bedside teaching. And the junior medical staff will be able to apply what they've learned in a simulated environment to the patients. It becomes a more safer environment, a safe teaching environment for them as well. So we're really having the best of both worlds.
I enjoy working with a multicultural department, teaching them and also learning from them.
So in maternity, we doubled our intake of graduate midwives for this year. The outcomes have been fantastic because we've had some clinical support for them. They've grown exceptionally well. They've come on board very fast because of the support. They've learnt very quickly, and the staff are giving them exceptional support going forward into their growth and development. They've enjoyed their time. That's all looking very positive for this year and the next year going forward.
Well, I love working with the team of nurses that I have on my board. They all work well as part of a team. They all have a lot of experience in the surgical areas, which we specialise in. Some of the nurses are even clinical nurse consultants in those areas. So it's good. A lot of the nurses that we have on our ward were actually grad nurses, which we've recruited, and being able to now have become part of the team and have been here for several years with us as well.